Welcome to our program on complement-mediated disorders in women, sponsored by the Foundation for Women and Girls with Blood Disorders. I'm Andra James. I know many of you in the audience. I am not Ravi Sirota. I have no disclosures relevant to today's presentation, but for those of you who may be new to the Foundation for Women and Girls with Blood Disorders, we were founded in 2009 and incorporated in 2010, and our raison d'etre is to educate healthcare providers about the unique needs of women and girls with blood disorders. That means primarily educating obstetrician and gynecologists around hematologic issues and educating hematologists about reproductive health care issues. Our vision is to ensure that all women and girls with blood disorders are correctly diagnosed and optimally treated and managed at every life stage. Our approach is to build awareness and publicize the unique needs of women and girls with blood disorders, to provide education and training for healthcare providers, to encourage successful collaborations among healthcare providers, but particularly hematologists and reproductive health specialists, to translate and disseminate that information, and to educate and support the next generation of healthcare providers who are going to care for women and girls with blood disorders. As Dr. Kenneth Mann put it, to provide the seed corn for the next generation. One of the things we are most proud of is that at this point we've achieved enough traction that we're able to provide small research grants to fellows, junior faculty. We coined the term pre-K awards. So far, we've provided $170,000 in research fellowship awards to 6 new faculty or fellows since 2016. Our most recent recipients are there in the left side of the slide. We've reached over 6,000 providers with our educational programs, and we've demonstrated that people have enhanced their knowledge in this area across all the educational programs we've produced. One of our other accomplishments that we're most proud of was the organized by our executive director, who was then our educational director, Carrie Funkhauser, who you may have met coming in. She helped us organize our first Learning Action Network, which began with a query from Christina Haley at Oregon Health Sciences University about establishing a clinic for women and girls with blood disorders at their institution, and that led to the formation of a Learning Action Network, which now comprises 152 members at 56 different sites in 27 states. Besides our Women and Girls with Bleeding Disorders Learning Action Network, we have, as of this year, launched a Learning Action Network around the needs of women and girls with sickle cell disease and reproductive issues. We had our first meeting in September. We have a directory of online services which you can access through our website. I'd like to say a little bit about today's program. Our first Friday Satellite Symposium at ASH was in 2010. We've had a hiatus for 2 years, but we return this year with this phenomenal agenda and our great panel of speakers. This was the idea of our organizer and moderator for this program, Gala Rapali, who approached me 2 years ago saying something to the effect of, what do we know about complement-mediated disorders in women, or how can we perpetuate our insight into this area? We had a board retreat the following January, in January of 2017, and we adopted the idea. And then this program has been in the pipeline now for almost 2 years. I'm going to turn the program over to Gal in just a minute or two, but I would first like to tell you that we've got a little change in the program. Gal Arapali is actually going to go first and give you the crosstalk thrombosis and the complement pathway and give you an overview of the program. And then Sanjay is going to give an overview of the complement pathway. And then the other two speakers who are switched are Jason Vaught, who's on the program at 8:45, is going to speak at 8:15, and Carla Nestor is going to follow him. Gal is my colleague and my friend. She's professor of medicine and pathology at Duke University. She is our platelet expert extraordinaire. She's the vice chief of research for our division of hematology. She's also the medical director of our therapeutic apheresis unit, and she's the one we call when we've gotten in over our heads with HELP syndrome, TTP, and other disorders that we're going to talk about more today.